Hello, everyone. Thank you so much for joining us tonight. I'm going to wait just a moment to let people settle into the room and to connect to audio. While we're waiting for folks to join us, please feel free to share in the chat where you're joining us from. Before we get started, I'll quickly go over some Zoom functions. We do encourage you to turn your cameras on and remain muted while our facilitators are speaking. You can access these functions at the bottom left corner of your Zoom screen. We will have closed captioning turned on. You can access this towards the bottom right corner of your screen. It will say show captions. The chat function should be towards the middle of the bottom panel. I see a few folks putting into the chat where they're from, so that's awesome. Please keep it up. There is an opportunity to ask questions at the end of the presentation, but you can also feel free to put questions into the chat box throughout the presentation, and we'll make sure your questions are answered before we leave. Lastly, if you love someone that something said, or you would like to applaud our facilitators, there is a button for reactions right next to the show captions button. And if you have any questions about the Zoom or the functions, please feel free to directly chat me throughout the event. Our goal is to make social workers an active, loud, and visible force in New York State policy. In anticipation of the 2024 legislative session, we will be hosting a series of chapter chats with prominent New York State mental health organizations with shared policy priorities to inform social workers about the organization's initiatives and amplify our advocacy efforts. Are you interested in learning the fundamentals of mental health advocacy, following mental health policy discussions, and engaging in action? If so, you are at the right event tonight. Thank you for joining us for the first chat in this series, and please join me in welcoming the Mental Health Association in New York State. MHA New York State provides guidance and leadership on how to address mental health issues in New York State. Tonight's facilitators are Glenn Liebman and John Richter. Glenn Liebman has been CEO of the Mental Health Association in New York State since 2004. MHA New York State is a member-driven organization working with affiliates across New York to educate the public about mental wellness while advocating to improve the mental health system and reducing stigma surrounding mental health. Mr. Liebman serves as the chair of the New York State Behavioral Health Services Advisory Council and is a member of the New York State Justice Center Advisory Council. During Mr. Liebman's tenure, multiple initiatives have been implemented, including mental health education, in schools, New York State being the first in the nation to have this mandate, funding of the workforce, anti-stigma efforts, college mental health, youth mental health first aid, and many other public policy reforms. Glenn lives with his wife and son in Albany, New York. John Richter has been the Director of Public Policy at the Mental Health Association in New York State since January 2008. Mr. Richter joined MHA New York State after spending over 20 years serving and advocating for the elderly and people with disabilities. He spent 13 years in long-term care policy with the New York State Association of Homes and Services for the Aging, specializing in adult home, assisted living, and home care issues. While at MHA New York State, John was instrumental in the passage of legislation requiring that New York schools begin teaching about mental health, beginning in 2018 as part of school health curriculum. John received his Bachelor of Arts degree in psychology from SUNY Stony Brook. He received his master's degree in public administration from Rockefeller College of Public Affairs and Policy at SUNY Albany. John lives in Albany with his wife, Susan, a practicing psychiatrist. Thank you so much, Glenn and John, and I'm going to hand it over to you for tonight's presentation.
Thank you, Olivia. Glenn was the other person or one of the other people who was instrumental in the passage of that legislation as well. We'll be talking some about that, but Glenn's going to kick us off.
Great. Thank you, John. And thank you so much, Olivia. I really appreciate it. Amelia, Olivia, thank you so much for this opportunity. Really do appreciate it. Anytime we get a chance to talk to fellow advocates about, the work that is done in terms of the public mental health system. And I'm sure a lot of what we're going to be talking about tonight, you're probably going to nod your head and say, yes, those are the things I'm dealing with every day, and the struggles and frustrations. And that's why we're here. And that's why we, encourage, as Olivia said, we encourage folks to be advocates, because we need you to raise your voices, because we are a system of care in so desperate need of everything, funding, obviously, but we need training dollars. We need virtually everything. And even with the governor's budget, workforce is still, it's a great budget, obviously, but the workforce is still integral to the success of any initiatives. So I'm going to do a thing, John and I have presented many times together, and this is an age thing. See if people get this, whatever, this pun or whatever. So we call ourselves the John Glenn Show. Does anybody remember John Glenn? Please tell me, somebody. John Glenn? All right. Well, if you did, John Glenn was a famous astronaut. Yes. Who actually was a senator for many years from the state of Ohio, and a great American. But anyway, so that's my pun of the day. You can generally tell by age who recognizes that pun. So I'm going to talk a little bit about MHA-NYS ourselves, our organization. We are, as Olivia said, we're a private nonprofit mental health advocacy organization. We are a state affiliate of Mental Health America, is our organization, our national organization. They're out of Virginia. They used to be called Mental Health Association, but then they changed about 10 years ago to call themselves Mental Health America. We're unique in the Mental Health Association movement in that we have affiliates. A lot of states, obviously we're in New York, so we're unique in so many ways, but a lot of states don't have any affiliates at all. They're just the state organization, that's it. We have 23 affiliates, which is by far the most of any other mental health association in the country. So we closely align ourselves with our 23 members. They're members in the sense that, they sign MOUs with us. We work with them very closely, their chapter supports and things like that. But they all do their own thing. We're not supervising them by any means. They do their own work as long as they follow sort of the work of the MOU, which is pretty it's pretty basic MOU, but we're very proud that these affiliates exist within our network. Many of our affiliates, again, as you can imagine, like any place, like I'm sure with NASW, you have chapters that are huge and you have chapters that are incredibly small. But we try to provide the best support we can for them in terms of our work, in terms of our advocacy. We listen to them, and we'll talk more about the process of how we go about creating our issues. But we do listen to our members. We take what they're saying, because they're the ones doing the work. We don't do direct care in Albany. They're the ones who are doing direct care. They're the ones who see this stuff every day. They're the ones when we're fighting for workforce, when we're fighting for different initiatives. They're the one every day that are seeing that. And so we listen to them. But what's also great, what I love about this organization, and I do love, again, I've been there 19 years and I love it. What's great about our organization is we're very mission driven.
Let me know when you're done so I can go upstairs.
We're very mission driven. So when we advocate, we're not only advocating for our members, we're advocating for the greater good of the community. So John had referenced, and he was such a major part of New York State becoming the first state in the country that mandated mental health education in schools and mental health instruction in schools. Now, that was not something that was specific to our agency. That was for the greater good of the entire state. And a lot of what we're going to be talking about tonight, whether college mental health, whether anti-stigma efforts, a lot of that is just for the greater good of the community mental health system. And our members buy into that mission, so they're very supportive of that. So that's really, really important to recognize. we focus much of our time and attention on legislative and regulatory advocacy. You'll hear from John later talk about many of the different initiatives that we work through. And we really are about raising mental health awareness in the community through various trainings, such as tonight's event. And the mission of our organization is to improve the lives of individuals, families, and communities by raising mental health awareness, ending stigma and discrimination, and promoting wellness and recovery. We believe in the large 10 theory. That's why, it was such a great opportunity when, Amelia and Olivia came to us and said, boy, we'd love you guys to participate, because we love to be more involved with NASW and the different groups that are out there. There are a lot of statewide mental health organizations. I'm sure many of you work with them very closely. Not only NASW, might be involved with some of the other organizations, whether it's NAMI or NIAPers or Families Together, but we have a large amount of mental health and behavioral health organizations that we work with very closely. So that really it's really about the greater good. And much like the credo of social workers, we're really trying to work and develop and identify priorities around mental health and how we can do better by the people we all work with and support. So I will so the history of the Mental Health Association movement actually is over 100 years old. A gentleman by the name of Clifford Beers, brilliant man who himself had a serious mental health issue. And he was in psychiatric hospitals. And just imagine, this is, 100 years ago, and he's in psychiatric hospitals and trying to recover. And he had the wherewithal to be a terrific writer and great writer, and he was able to recover. And really the start of the peer movement was identified around Clifford Beers. So that is something that we take very seriously as well. And again, our credo is that, if you know anything about the Mental Health Association, you know about our bell. Our bell is sort of the branding that we do. And the bell, it's housed at the National Mental Health Association organization. And it's this huge bell, but it's amazing. It's from the shackles of, that bound them, that, when you think back, people were in chains, and these shackles and these chains were used to develop and create this bell in the 1950s. So it's a real testament to how far we've come. We know we have a long way to go, but it really is a testament to how far we've come. And so I'm gonna talk about, I'll hand this over to John, but I'm going to talk at some point. The number one priority that we work on is around workforce issues. But John's going to kind of just walk through a little bit about our priorities, and I'll come back and talk about the importance of workforce and some of the initiatives that we're doing. And hopefully they will align with you. And these are kinds of things that we'd love to work with you on. So John, I hand it over to you.
Thanks, Glenn. So Glenn has already talked a little bit about how we set our legislative agenda, that our affiliates do play a role in that, but they're also very supportive of, they're also very supportive of different initiatives that we take on that don't necessarily affect their bottom line, but that better the mental health system as a whole. And we also have a very supportive board. So we certainly take some direction from our affiliates. We have a fairly wide latitude in trying to identify here in Albany the types of issues that we believe are important and that need work on. So we do that to set and develop our legislative agenda, which I'll be getting into a little more in just a moment. And then we advance our legislative agenda, obviously, during session. We focus very heavily, as I'm sure NASW does, during budget season. We're very very focused on the budget process and the elements of the budget that are important to us. As Glenn already mentioned, last year's budget was a very good budget for mental health. I think Glenn has said this before, but I concur, is that in all the years that we've been doing this work, I'm not even sure we heard the words mental health in the state of the state, but it was front and center this year. And the governor committed $1 billion to mental health. So that was a good budget year. Glenn's going to get into some of the specific budgetary issues we've been dealing with in a little while. But then we sort of segue after budgets passed, usually in early April, into more of the programmatic bills in the legislature. And we're active doing that, obviously, all the way up until the end of session. Off session, we try to do work. We do more of our research and development of our ideas and our proposals, meeting with legislators during the downtime and working our agenda that way. But a high point of our the legislative session for us is our legislative day, which is called Mental Health Matters Day. And that this year that will be on March 13th, 2024. I think many of you are probably familiar with legislative days. I know that NASW has a capital action day. And there's a lot of similarities in our legislative days, and you know, there are many associations that have legislative days. Ours is an opportunity for us to sort of invite people who want to advocate about mental health to participate in that, and we try to empower them and equip them in ways that they can do that advocacy. So while yes, our affiliates are there and allied associations are there, there's a lot of just New Yorkers there. And more recently, in recent years, we've had a huge participation of young people, because Glenn already referenced the work we've done around mental health education in schools, and we've gotten young people very involved in mental health advocacy. Actually, the year before, a few days before the COVID pandemic was declared, we were slated to have about 700 or 800 people come to our advocacy day, and a big majority of those were schools. So we're trying to get back on track again. We did have a live legislative day this past March. We're planning on another in-person legislative day this March, and we're already engaging schools. We're hoping for a big turnout. We certainly hope and invite and welcome any NASW members to participate in our legislative day, and we certainly would be happy to participate in yours. I think, because as we'll see shortly, I think you're going to find that we have quite a few things in common and common ground that we'll be working on. So Ledge Day ends up being a sort of a pinnacle of the session, but I think we're not unlike most other, advocacy groups in how we navigate the legislative session, so we can continue on from here. I tried to think about how I could organize a lot of the legislative work advocacy we do around some just sort of constructs or guiding principles. And it occurred to me that practically everything that we do falls into these two categories: access and awareness. And I've put some examples of what I'm talking about there. We'll be talking more about them. But when we talk about access, we're talking about anything that enables people to be able to access the mental health system, whether that involves the need for more mental health workers, more counselors, more therapists, more frontline workers, recruiting and retaining them, or whether it has to do with issues like, payment, whether it's Medicaid or it's parity in insurance. We're also focused on capacity. So, in the community and inpatient as well, in housing. So there's so many things that we do that really just have to do with making sure that there's a supply that's adequate to meet the demand. And we all know that we're not even close yet. We have a long way to go, but that's what we're working on. So a big part of what we do has to do with access. And then another big part of what we do has to do with awareness. So we're always trying to build mental health literacy in communities and across the state. And whether that's through various training programs for elderly people, things like mental health first aid, or if it's reaching youth through the education system, or higher education. So whether it's suicide prevention, we've done different things that passed legislation where the proceeds went to a mental health awareness fund that resides at OMH. Things like you can get a license plate with our credo on the license plate, a mental health license plate, and you can check off on your taxes a box on mental health, and the proceeds go to the mental health awareness fund. So there's a lot of things that we do that fit into awareness. So really, I'd say these two sort of guiding principles encompass most of our advocacy. If I was pressed to add one more, I'd probably say disability rights. But that's just a way of sort of conceptualizing what we do. And now I can get into some of the more of the details if we advance to the next slide. Thank you, Olivia. So lots of words, and I apologize in advance. And I put these all up here for you to sort of eyeball while I'm talking a little bit about our legislative agenda. I wanted you to see by this, not that I'm going to go into every one of these, but I sort of wanted you to see the breadth and the diversity of the issues that we deal with. What this represents here is our legislative agenda, which is encompassed in our legislative briefing book. All of these issues, I think Olivia is going to drop into the chat that link there that you see on the screen right underneath legislative action community, which I'm going to talk about now a little bit. So we created a legislative action community, and it's a big part of our advocacy strategy. The legislative action community, or the LAC, is a place where people who are interested in mental health advocacy can be equipped and empowered with the tools and the resources that they need to advocate on behalf of mental health issues. You'll find a number of resources on that site, not the least of which is our legislative briefing book. So it takes each one of those issues that you see on the screen there, and it goes into some more depth about what the problem is, what we think the solution is, and what the recommendation is, or what the legislative ask is that we're trying to achieve. But in addition, on the legislative action community, you can find things like all of our memorandums of support. You can find our issue briefs. You can find white paper reports. You can find testimony that we've delivered. Really, we're an open book, and anything that we've ever issued in a public way is available on that site. But we also have resources for people who want to learn how to advocate. We have videos and training sessions on, advocacy 101 and how to set up a meeting and conduct a meeting with your legislator. We have a whole section on how the state budget process works. So there's a lot on there for people who really want to take a deep dive, and there's some other resources for people who just kind of want to get their feet wet and learn a little bit about advocacy. So if you want to look a little bit closer and study some of our issues, you can please feel free to access that site in our legislative briefing book. You'll notice here that I've highlighted a few items in red, and that's because, as a relatively small nonprofit organization, that you can imagine, it's difficult to put equal measure of energy and time into every single one of these issues. So generally speaking, each year there's a handful of issues that are particularly important to us and that are priorities. And that's what Glenn and I are going to continue to talk about. We're going to delve into some of those. Certainly during the question and answer session, if you want to raise a question about any of these other issues you see on the screen, we'll be happy to address those. So Olivia, if we could advance the screen. One more thing quickly is that what you don't see in our legislative agenda, but it's something that we do work on, and that involves when we're in coalition with others. So we do work occasionally on different topics in coalition with other organizations, like-minded organizations. I just put two examples up there. They're by no means the only ones, but what you see there is a pharmacist-administered long-acting injectables, fancy way of saying it's a legislation that would allow pharmacists to give people their long-acting injectables. So that's an access issue, right? And step therapy. So there's a number of bills we've worked on with other groups to try to eliminate the practice of step therapy. Again, another access issue. One issue that's not written here, it's a little bit older, but probably the biggest issue, I think Glenn would agree, that we've worked in coalition on was Timothy's Law, when we had parity in New York State many years ago. But just again, another example of the fact that MHA-NYS does from time to time work in coalition with other organizations. So that's all I wanted to say there. And so now we're going to start to delve into some of these, what we would call our highest legislative priorities in the coming session. I'm going to hand it back over to Glenn.
Great. Thank you very much, John. And just, one of the other things is, John mentioned and referenced, please, we'd love if you wanted to join us on our Ledge Day. We hope to have, the 800, 900 people that we were supposed to get 3 years ago. We already have people registered, several schools registered, and really it is a great day. We bring in legislators, we bring in the mental health commissioner, we bring in the real experts, and it's a real opportunity to hear what's going on, and then go and go do your advocacy and things like that. So that's really important. So I hope I hope you will come join us this year. So the thing that I really work on the most, I've got to say, is a lot of workforce funding. It is become priority of our organization over the last half dozen years, at least. We are advocates year after year for the cost of living adjustment, the COLA. We fight for that every year, it seems, year after year. Some years we do better than others, but it's basically, based on the legislation from 17 years ago, which was the COLA for all the human service sector. And it was based on the consumer price index, the CPI. And over that 17-year period, it has basically been ignored, not funded, to the point of John Torriello, who's our counsel and used to be the counsel at OMH. John has done work on this and has come back and said that we have lost, in the 17 years that there's been a cost of living adjustment, by not getting that COLA for most of those years, we've lost over 33.33% of our funding for mental health and human services. Can you imagine if we were able to get that money, if we had gotten cost of living adjustments every year for the last 17 years, consistent with the CPI, where we would be versus where we are now? So it's just, the trajectory is just, it's awful. And there's no other way to explain it. But the last several years, there's, with Governor Hochul, there's been somewhat of a breakthrough. Last year, the year before last, rather, 2 years ago, when she first came into office, the CPI was 5.4%. That was the first year in the last 17 where we actually got that 5.4%. And we also had workforce bonuses as well, which you're probably aware of. The workforce bonuses were not something we had advocated for. We'd rather have seen that as part of the COLA, because, as we know, workforce, but those are one-time funding. We want to see the system strengthen, and we want to see that money annualized year after year. And while it's nice to have a bonus, it's one time. So we fight every year for the cost of living adjustment. This past year, the cost of living, the CPI was 8.5%. So we spent all of basically since January, February, March, and actually April this year, because the budget came out so late, we fought very hard to make sure that 8.5 was in there. The governor, in her budget, put in 2.5%. So we were working with the legislature to increase that by 6%, well, 6 percentage points. Unfortunately, they only added a percentage point and a half, so we got to 4%. So 4%, they would come back to us and say, "Hey, you've gotten almost 10% in the last 2 years. Isn't that good?" It's okay, but it's not going to retain staff. You're dealing with a 33.33% impact to this budget over the last 17 years. So yes, it's positive, and we thank the governor, we thank the legislature, but there is so much to make up for. And that money is tied into, again, a COLA, which is good in terms of the flexibility of a COLA. An agency can determine if they want to give it to their workforce, or they could help pay for insurance coverage, things like that. So there's flexibility that's built into the COLA, which is a good thing. But on the other hand, again, it's just not going to get done with just these small kind of Pyrrhic victories. So we will continue this year. The cost of living adjustment is about 5%, 5.4%, as like it was 2 years ago. And we're going to continue to fight for that in the budget. We absolutely will fight for that, and we'll continue to raise our voice. If any of you get, follow our listserv, which is a free subscription base where people can sign up to get into our listserv, you'll see the constant call for the cost of living adjustment, because that's what the workforce needs. That's what we, and I'm sure every one of you who's on this presentation can cite stories about the impact of not having that kind of workforce that you need, and what that means to the agency in terms of waiting list and individuals' recovery and their family engagement and things like that really matter. Yeah, unfortunately, because we can't keep people in this field, because we can't pay them what they deserve, and certainly social workers are up there at the top of that list. It's sad that these are jobs that are so important and so significant in impacting people's lives, and yet we have to fight every day to get a small percentage increase. So that's why we really laud the work that you do, because we know you're not doing it for the money. That's for sure. We say, and we do work a lot with direct care folks also. We have a lot of our members who do direct care, and we'll get into that in a minute. And, I always say that, people come into our field because they have a vision. They believe they're mission driven. Maybe they themselves are family members. Maybe they themselves are peers themselves. But you know what? Mission driven doesn't put food on the table. We need to make sure that we have the kind of robust workforce that is imperative to us moving forward. And again, the governor's budget was incredible. As John said, we scurried for the last 20 years looking for some governor to mention mental health. Here's front and center, and it was great. But the thing was, it was not about the workforce. There was just that 2.5% for the workforce. So you can create the greatest programs in the world and services in the world, but if you don't have the funding to back it up, to hire the staff that needs to accomplish this, what's the point? So we kind of made sure throughout session to carry that message. So again, it's unfortunate, but we'll keep fighting for that. But the second piece here is something we're very excited about. This, so obviously COLA will be front and center, and if you come to our event or you follow our advocacy throughout the legislative session, you'll see so much about COLA every day, every week, action steps, advocating, working off session with the executive, because that's frankly where a lot of the action is done. Once it comes to legislative session in January, a lot of the budget's already been cooked, and the executive has all the money. So the legislature comes in and they're actually working with us on the fringes, because it's not like they're sitting there with a $220 billion budget. So we do what we can, but a lot of times it's off session that we do a lot of our most significant work. So, but we have devised a strategy that I think will hopefully NASW will be interested in signing on as partners for this. We have said, okay, we don't want to come back year after year and fight for a COLA. We just it's draining, and it just doesn't systemically change our system. It's a shot in the arm, and it's a good shot in the arm, but it doesn't sustain the system. What can we do long-term to sustain the system and create a workforce that is able to be, retained and recruited? We all know the frustration. Every one of us knows this frustration. So what we decided to do is we're looking into the whole idea of creating a pension and retirement plan for the nonprofit workforce. We know state workers, county workers, city workers, law enforcement, police, firefighters, teachers. We know they all have a pension plan, a retirement system. And though it's not like it was 20 years ago in the state in terms of pensions, it's still an incentive. It's still a great ability to say, okay, I've now been with, this nonprofit for 5 years. I get X amount of money when I retire, or I can take it out now, or 10 years, et cetera, et cetera. And you build up careers. You build a career where you can say, I'm going to work at the Mental Health Association for the next 25 years. And when I retire, much like a state worker, I'm going to have some sort of pension, some kind of ability to, pay for retirement, be in the retirement system. And believe me, I worked for the state for 11 years. I can tell you that the pension system was major reason that most people stayed in their positions. So if we want to really retain quality staff and recruit quality staff, we have to have something that aligns with some sort of pension and retirement system. Now, it's not going to happen tomorrow. We know that, but so what we're doing is we want to study the impact of this, because there will be costs that are involved in this from an employer perspective, and also from, the state perspective, and hopefully the federal government will kick in as well. There's this whole notion of how much it would cost to create some sort of similar design to a retirement system from the state. So we have been, initially we had legislation last year that was sponsored by Assemblywoman Gunther, and it was going to bring several state agencies together. But we talked about this, and what we decided to do, and we still might do the legislation too, but what we decided to do is we decided to reach out to some of the academic institutions in New York. So we reached out to the Cornell Industrial Relations School, and we just met with them last week, and they are very excited and very interested in doing a study with us to find out what the cost would be of something like this. They loved the idea. They thought this is a great idea. This is something that could really change the playing field for the community, not only mental health system, but for the human service system. And I should step back and say, we're not only talking mental health here, we're talking human service system. So we're talking about 800,000 people. So we're not talking about a small amount of people here. So we're very excited. And please, if you are interested in finding out more, please reach out to John or myself. We'll give our contact information at the end. And if, NASW is interested in joining our coalition and just signing on, that would be wonderful too. So we are very excited about that. And we look at this as sort of like, this is the framework for the future of our system of care. The third thing I want to talk about is something that the state rolled out last year that didn't end up happening in the budget. It's called, OMH created something called the Qualified Mental Health Associate, called the QMHA. It's not dissimilar, for those of you who are in the world of OASS, it's not dissimilar from a KSAC. It's not dissimilar from in OPWD, DSP, Direct Service Professional. OMH has nothing like this. So we were trying to work with them to help create this position as not a clinical position. We would not be up against scope of practice. I know that, obviously you guys are, you have spent many years in school and appropriately have created a scope of practice around your issues and, around your credentials, which is totally appropriate. But this would create somewhat of a paraprofessional to work with not only social workers, but other clinicians as well. They would have different responsibilities, much like my son's a KSAC. So my son does a lot of work with the counselors he works with around the design of, the work plan, around groups, around crisis services. So he, but he doesn't diagnose, even though KSAC can't technically diagnose, but he's not there yet. He doesn't diagnose, but what the Qualified Mental Health Associate would be essentially someone would be a paraprofessional, but would have the ability to move up the ladder, because we have so many people who are stuck in want careers in mental health, but don't necessarily want careers as a clinician. You graduate high school, you want a career in mental health, you go to a 2-year school, go to the associate's degree, even a 4-year degrees. We know there's more than 2/3, I believe, of psychology majors don't even go into our field. So we look at this and say, this is a long-term thing that we can sort of incent young people to come into our field. And those who want to be clinicians, we want to make it as easy as possible. For those who want to be social workers, we'd love to help create the path for that to happen. But for those who are not going to be social workers or psychologists or psychiatrists, we want to also create a path for them. That is not, again, it's not the same path. We would not infringe on any sort of licensure issues, but it would be a path for someone who's interested in becoming in getting involved in the mental health field to move up the career ladder. So those are some of the things we're working on. And we're very excited about it. Next on the list. Hand it over to John.
Thank you, Glenn. And I want to leave enough time for questions, but so I'm going to kind of rapid fire here, not because these are any less important, but certainly workforce is really front and center for us because it's hard to do anything else without an adequate workforce. So it's really, we are spending a lot of time on that. But, you know, as we mentioned already, our foray into mental health education began in 2016 when we helped pass legislation to require schools to teach about mental health. It became active in 2018. And, you know, we've learned a lot about the needs of young people, the needs of schools. We really have a passion for young people. We believe, you know, they're the next generation, and it's really vital that that they are knowledgeable about their own mental health, their peers, their families, mental health. And so we're working hard to do that. So here's a number of school-related bills that we've been trying to advance. The first one has to do with teacher training. And this bill would require teachers to receive some amount of training. It's not a lot. It's 3 hours of mental health training annually. And we understand that teachers have so much on their plate that they have to do, but we think this is vital. And, you know, it might even look like, and I guess we're guilty of sort of putting the cart before the horse insofar as we got legislation passed that required students to learn about mental health, but there was no requirement for teachers to understand anything about mental health. That's what this bill would change. So it's our work is cut out for us. It still needs a sponsor in the assembly, but you know, that's something we'll be working on. Another issue we're working on is, Glenn alluded earlier to, mental health days. You know, we would like to see young people be able to take mental health days when necessary. I guess it's a better way to put it is that there really wouldn't be any kind of a distinction, really. Like, everybody would come to a point that understand that your mental health is your health. But in the way school districts define what a mental health day is, this law would sort of pave the way to allow school districts to consider mental health days as legitimate absences. We think it's more of a cultural move than anything, insofar as when you talk about this, when you make it understood that it's available, that it will help advance the climate and culture of mental wellness in schools. So it's somewhat symbolic, but also very important. So that bill does have an assembly sponsor, and we're happy to share that information with you. I don't want to belabor it too much now. There is an assembly sponsor there, as there is with the next bill, is also got 2 sponsors in the Senate and in the Assembly, and that's a suicide prevention bill. I think it's about half of schools currently have a suicide prevention, intervention, postvention policy in place. And this bill would require that schools have a model policy in place. There is actually resources along those lines available. If you're familiar with the Trevor Project, they did a lot of work putting together a model school policy. So this really wouldn't be something, although it, you know, it would be a mandate, it wouldn't be a huge lift for schools, because a lot of these resources are already available, and part of the legislation would involve making those resources available to schools so they can adopt those policies. And then the final issue here, where we've been doing a lot of work lately for the last few years, is on mental health in higher education. We got interested in this issue, if some of you recall, a lawsuit that took place at Stanford University several years ago, where the plaintiffs, brought a suit against Stanford University claiming that the school had violated their rights under the ADA around issues like leaves of absence and return to school, and those kinds of things, and the way that at least in that school and perhaps others, there was almost a punitive nature to the way that students with mental health issues, and who may have even self-harmed or attempted suicide, in the way that they were dealt with. We would like to see more training in school in higher education for teachers, actually for all staff on campus, as well as for students. Perhaps more information at times like during orientation about mental health. what to expect during during their time in college, what to do if they are struggling, how to identify when they're struggling, how to get help, things like that. So part of the legislation that we're trying to advance has to do with training, and part of it has to do with resources so schools can have those policies in place. There recently was another lawsuit at Yale University that looked very much like the one at Stanford University, and it came down to the same issues. Leave of absence, return to school, medical necessity, readmission, and reasonable accommodations. So some of what's been done, what we'd like to do is to be able to equip colleges and universities in a way that these things wouldn't have to be dealt with in a lawsuit, that schools would be, more proactive in the way that they approach mental health, and try to drive, again, just like with primary and secondary education, through all of this, trying to really drive a cultural and climate shift around mental wellness and awareness. So that's some of what we've been doing. I think we have another slide here, and I'm going to finish up pretty quickly here. We've already talked a bit about the mental health education in schools. We do have a school mental health resource and training center. We went back to the legislature after they passed the education law. We went back and we said we could really use some money to help schools build their curriculum, so that schools are equipped to be able to teach about mental health. And the legislature gave us some money, and in subsequent years, we've gotten money in the state budget to run our school mental health resource and training center. And that's a place where schools can get training, they can get resources to help build their curriculum. And then the rest of what you see there are all different versions of mental health first aid. I'm sure many of you are familiar with. There are different types of mental health first aid for different populations. And the only reason I included it here, because most of our funding for these come through the state, although, we do some private pay type of work with corporations and things like that who are able to pay. But the state has, over the years, provided us with some funding. And at times it's been necessary to go to the legislature. And we've had legislation passed that funded some of these programs. And again, this is consistent with the work we've been doing around awareness, around raising mental health literacy, not only in schools, but all in the general community. So I think that rounds out everything. Sorry to do a lightning speed finish up there, but I did want to leave some time for some questions, if anybody has any.
Wow.
I have a question. What current organizations do you guys partner with or that back these current policies that you guys are proposing? I know you guys are interested in gaining NASW support. Who supports you
Sure.
currently?
No, I'll take that first, John, and then
Sure.
Thank you, Jacob. It's a really good question. So there is a group that meets weekly of the several of the statewide behavioral health advocacy groups. So, for example, NAMI, us, Families Together, a coalition in New York City, NIAPers, who largely they're peer-driven group. Association for Community Living, who are supportive house. They represent housing providers. I'm trying to think of 3 or 4 other organizations. So we meet weekly to talk about some of the big mental health issues. So where we really aligned was around the COLA, because we all have disparate agendas. We have this agenda that we shared with you, and a lot of those are well, we're not involved with schools. That's not an issue to us. So our members aren't telling us we need to do that. So everybody's got their different issues. So where we completely align is around the cost of living adjustment. So that's where we decided that's where we would put together and work around that. But we also, again, have John referenced some of the other issues. Today, John and I met with the American Foundation of Suicide Prevention to talk to them about joining us in our legislative event this year. So we're always looking for partners. We all, we believe that this all mutually benefits everyone. So, yeah, so that's what we do. I don't know, John, if you wanted to
Yeah,
add.
no, I think Families Together is another one that we organization that we've worked with. I think Glenn named most of them, but really, most of the statewide mental health, behavioral health advocacy organizations from at one time or another, we've worked on various different issues with.
Yep. Yep. And clearly with like mental health parity, we worked with you. We worked with NASW, we worked with the psychiatrist, we worked with the psychologist. So those were major issues, and we really worked very closely with NASW on that one.
That's one of the reasons we were so happy to be invited to talk to you guys, is because we'd like to do more work with you. And especially when we're thinking about workforce, when we're thinking about, the fact that we don't have enough clinicians, that they're not paid well enough, the reimbursement's not high enough. We need to do more. And in order to do more, we really need to ally around those issues.
Absolutely.
Thank
And
you.
you guys are a very powerful group. People listen to you. You're very powerful.
Looking in the chat.
I love that dog.
So much.
Ariel, I love that dog.
Well,
Thank you.
I currently learned-
She's not mine. She's a friend's. But she loves me very much already.
I can tell.
Hey,
Oh God.
if
All
I knew
right.
there was going to be time left over for dog shows, Glenn and I would have been happy to have our
Yeah,
little babies.
Yeah. My dog's running around out back. Yeah.
Well, if you hear any background noise, that's my puppy enjoying her Kong toy. Well,
You've had
certainly
for a
learned
month.
lot.
You've had for 3 weeks.
Olivia, I wonder if
Yes.
any of the folks on the line have any thoughts themselves about, what more we can do around creating opportunities for people to get into the mental health workforce. We really like to, whatever ideas, in whether it's incentivize, how do we incentivize people? How do we create more career ladder type of opportunities? Something that we're very interested in. We certainly would love to hear, your input, if not today, so in the future.
Yes.
Absolutely. Please feel free to unmute and share any suggestions if you have any immediately. If
Yeah.
not, you can always email myself and that will get connected with John and Glenn and see where we can work together.
I can throw out an idea. I work at a university, and it's primarily a STEM university, but we do have a psychology program. And most of the majors, students are told not to even consider an internship that isn't paid. And in human services, we know that mostly we pay our tuition for the privilege of doing an internship. And I have started advocating, we're looking at expanding some of our education opportunities and working with local employers to find ways to give some type of stipend, even if it's, not huge, to start moving in the direction of giving some payment to interns for their hours of service, because I think that we are way behind the curve for other professions. And I know none of us think we're going to get rich in this profession, but it's unfortunate that, that's not happening. And I think that sends a message to people right from the undergraduate level and through graduate level that that's not a norm here.
Yeah.
That's a really good point. That's good. We'll bring it back to our folks because we have a group that meets on the pipeline group. That's an excellent point. And you're right. It does set up a message from day one, like our work is not valued. Maybe it's valued, through mission, but it's not valued in terms of payment. You're absolutely right.
And I think, from a legislative standpoint, creating some funds that maybe are, matching funds that employers who provide interns with funding, and having some matching funds starts to move the ball in the right direction, and then create some incentives for other employers to consider, paying and creating that norm would be great.
That's great. Excellent. Thank you.
That kind of partnership, is important if the state's willing to put up some as well.
Yep.
Good ideas. Yeah.
Excellent.
I was one of those psychology majors. I ended up going into public policy. I toyed with the idea of going in clinical psychology, and I didn't. But you know, the hard part was I really liked it, and I struggled to find anything that I could do with that degree that was in that vein of you know, and I did find, you know, gratifying work working with people with disabilities, you know, as a direct care employee with a 4-year degree, and that was great. But then where do I go? So there's, like, as Glenn said, it's just a ridiculous number of people who graduate with 4-year degrees in psychology and sociology that never go beyond that.
Hi there. It's Elizabeth Rapoli. I'm sorry I'm not on screen. I'm actually in the car, but connected to both previous person was speaking, as well as what your point just was, is also looking at either loan forgiveness programs or programs that like the Department of Education has, or I know some of the DD organizations where you fund graduate school tuition with a loan forgiveness piece for that incentive of people staying longer. So that was just, and I know that's being done in pockets, but I think that, you know, that those two, the combination of those two and expanding on the programs that are already available could tie in very nicely with both of your points. So another piece.
Thank you,
Bring that
Elizabeth.
back to, that's great. Yep. Excellent. This is great.
All right, well, thank you all so much for joining us tonight. I apologize for my dogs barking. Before I let you all go, I did just put a link to our priorities to check out our NASW advocacy website. A lot of the information that, I'm so sorry. A lot of the information that Glenn and John shared is very similar to our priorities. I'm gonna let you all go because I'm not sure if you can hear me over my dog. But thank you all so much. I will be putting this recording on YouTube and an email.
Thank you, Olivia. Thank
Great,
you, everybody,
thank you.
for joining.
Thank you so much, everyone. Really
Thank
appreciate
you,
it.
everyone.
Thank you.
Thank you.
Yep. Have a good night.
Thank you.